Welcome everyone to day 2 of CTech 2021. I know meeting virtually is a little different, but let's focus on the positive. We all get to meet, learn, and have fun. So thank you for registering and let's get started. I'm Kelly Swails and I work as a Senior Clinical Educator here at Census Technologies. So in my role, I write articles, do webinar presentations like today. I'm also a clinical resource for my coworkers, but the most fun part of my job is I travel to US, Canada, Puerto Rico, and I go into facilities and I do CensiTrac utilization assessments. So what does that mean? So I'll come in, look at your CensiTrac from figure like A to Z. Look at modules, features, functions that perhaps you're not using to the full capabilities, or maybe you don't know how to use it, so we can help you learn that. Along with that, look at your inventory. Are there containers that don't have a count sheet? We can help you get one in there. Or if you have containers that don't have an actual created, let's hide that. So when you're searching for something, you don't have that in the mix. Or your scope inventory, let's look at that. If something has been processed since 2013, 14. Safe to say that it's probably no longer in your inventory. So let's get rid of that or hide it. And then along with that, if you choose training, then I arrange for one of our clinical educators to come on site for a training event. So with all of that, and what I do, I go to about 60 to 75 facilities a year. So as you know, then I see lots of things. I always want to learn something when I go. Sometimes it could be something about your city, your state, your hospital. Maybe you teach me something about CensiTrac, because that has happened. But along with that, I see some commonalities, some trends of things that people don't know they should be doing or don't know that they can use CensiTrac to document this. And so my goal here today is kind of, put everything together, look at the life cycle of a container, that back to basics, and then with that, help you to utilize CensiTrac for, best practice, efficiency, and compliance. So as we get started here, so our objectives. So today we're going to talk about life cycle of a container. So from decontam to point of use, back to decontam, we know it's a never-ending cycle. It's always ongoing. And with that, though, there may be steps that are being missed or aren't documented. And you know the old saying, if you didn't document it, it didn't happen. So during this presentation, we'll identify some of those areas, explain the why behind what should be a part of your processing, what should be documented, and then how you can do that in CensiTrac. So decontam, good old decontam. So right off, so AAMI ST79 clearly states that mechanical cleaning equipment should be tested each day that it is used. And it should be documented with the name, date, and time of who is performing that task. So one thing that speaks volumes to me is that it should be tested each day that it's used. So if you don't staff on the weekends or holidays, don't have to worry about it unless they come in to, for an add-on case, then that would be one thing. But one thing that I'm seeing a lot is that people are not doing or performing a wash test in their cart washer. Well, a cart washer is a mechanical washer. So we need to test that according with AAMI guidelines. And I'm guessing it's probably in your IFU too, or that manual for your washer that says it. And so many times I hear, yes, but we don't process instruments in our cart washer. And so while that may be true, what about the basins? What about your case carts? What about your rigid containers you may be putting through there? Or if the OR sends down, mail stands and back tables to get cleaned. So if you're not doing any wash test at all, then how do you know that your detergent solution is correct? How do you know that things are getting clean? Along with that, with your washers, where I said it should be tested each day that it's used, I'm still seeing weekly testing. That did change 2017, where they went from weekly to daily. So highly recommend that everyone is doing that wash test daily and that it is for all your washers, whether it's an ultrasonic, mechanical washer, an eye ultrasonic, a cart washer, everything should be tested. And I can speak from experience, years ago when we were doing just weekly testing. So I had a staff member who had swapped out at the same time a detergent and the instrument lubrication, mixed up the bottles or the hoses, And so we went a couple days without knowing that that had happened until we ran that wash test and it didn't pass. Just trying to figure out why it didn't pass and then figured out the problem. So right then and there, all those instruments that were washed in between that change of the chemicals until that next wash test, none of those were properly cleaned. So yes, it was kind of a nightmare to have to fix. But if we were doing them at least daily, we would have caught it that next morning, rather than only had a few instruments to have to take care of. So next on here is a good old pre-cleaning. So the frustration that comes with seeing a tray that hasn't been pre-cleaned, I know it could be overwhelming. I know that talking about it here is preaching to the choir because we know it needs to be done, but this needs to be told right directly to our surge techs or OR aides or whoever's doing this. It is right in all the surgical technology books, their guideline, everything that it starts right in the OR and then it should be done. One thing with CensiTrac is that we do have our quality feedback module. Highly recommend you do that. Now there's the option to go and create a barcode. So with 3 simple scans, you can create a quality feedback event for pre-clean that wasn't done, to where if you created one that said, if you created an event that said no pre-clean and this tonsil and adenoid tray comes in, I'm going to scan that barcode that says no pre-clean, scan that container, scan that barcode. I just created a quality feedback event in about 5 seconds. Then I encourage you to set up a report, set up that report as an exception report, and we'll just pick on the OR. Have that report sent to OR leadership as well as your sterile processing leadership. You may want to put in infection prevention or compliance because I know that it's something Joint Commission looks at, and you don't want to no one wants to get dinged for something. So put whoever needs to get that information, and that way when they come in the next morning, they get that list saying, here's what was not pre-cleaned yesterday. Now they can bring it right to morning report or afternoon huddle or post it on a board. And then that way staff are seeing this and they're aware because maybe it's somebody new and they didn't know where a new bottle of solution was to spray it or something. I was like, everyone the benefit of the doubt and work on education. So with that, if you are, kind of getting it right there, right when it happens, then you're going to see it decrease rather than waiting for a month-end report. Along with that, they can also then see that this was created at 11 o'clock and it was a foot tray. Oh, that must have been, Dr. Smith's bunionectomy at 9 a.m. Well, now we know who was attacking the room, go right to them. They're the ones that need the education. So highly encourage everyone to use that quality feedback form, specifically, for anything, but really do that point of use cleaning, that pre-clean. That's one way we can see those incidences of no pre-clean start to minimize. Next on here, I have rigid containers. So rigid containers, when I'm on site and I see rigid containers, many times if you don't have a cart washer, I'm seeing that they're not being cleaned. So you can look at the IFU, you can look at AAMI guidelines. There's a little bit of controversy with some of those IFUs, but AAMI clearly states it should be cleaned before sterilization. So if your facility is taking those containers out of the room before the patient comes in, bringing them down to sterile processing, and then they're considered clean because they're never, by a patient, never had dirty instruments in them. And then they're just sitting there waiting for the basket, the instruments to be washed and come back through. Are they being cleaned? Now I see some facilities that are cleaning them inside that basket with disinfectant wipes. So Santa Claus is a common one I see, or they're cleaning them with alcohol. And what concerns me is that when that residue dries, once it goes, you think, okay, it's fine, it dried. But when it goes in that sterilizer and that steam hits it, you're now making that dried residue fluid again. So is it ending up on our instruments? What's it doing to the instruments? If it's on the instruments and now you use them in surgery, maybe it has dried, but then you've got, blood and saline that's going to reactivate that again. And so what is that chemical doing to tissue or organs? So highly encourage everyone to, evaluate your process with that and then see what you can do to be in compliance and yet still be efficient and make everybody safe. So on to cleaning instruments. So when you get your instruments into decontam, this is probably the one area I see that's missed the most. So people are either not scanning the decontam at all, or they're scanning to a sink, but they're not scanning to the decontam module. Highly encourage everyone to scan to the decontam module, because if you have any clean instructions that are attached to a container, you're never, ever, ever going to see them unless you scan to that decontam module. And so with that, when I scan the decontam module, I get a pop-up that says, you know, make sure all the bone is off the reamers, or make sure all the cement is off the cement gun. This laparoscopic grasswork comes apart into 4 pieces. So it's things like that that can be very helpful, especially if you have new staff or staff that are new to sterile processing, or new to your service. So if they work at a hospital, they didn't do laparoscopic, or they didn't do hearts, and now they come there, maybe something that they don't know about some of these retractors and instruments. And then it'll document in the container history that it was cleaned, and staff will also receive productivity credit for doing that work. And we all like credit for the work we do, so great way to do that. Along with that, if that container is part of a recall, so for example, if you had a wet load, and so you issued a recall for all your instruments, and as you issue this recall, everything in that load then is now flagged, returned to sterile processing, this item's been recalled. Well, if that set has been scanned to the decontam module, that alert will be withdrawn. So staff aren't going to have that. And so now you're kind of narrowed down, you know, how many sets you need to find, and they're not going to get that recall every single time it's scanned, because it's been sent to decontam, and thinking of it as decontam always restarts the cycle. Next on here, scanning to your washers and cleaners. So I hear, you know, we only have one ultrasonic, we only have one washer. Why do we need to document which one we send it to when we only have one? It's not so much which one I'm sending it to, as it is, think about your sterilizers. So we have no problem creating a sterilizer load. When that finishes, looking at the tape, making sure my parameters were met, 270, 10, 45. I verify everything's correct. I go into CensiTrac, I document that pass-fail, the cycle, document my biological, all that information. Well, it's kind of the same with your washers. So if you're not verifying that load and you're not looking to see, did this load pass? Was this load ran on the correct cycle? Then how do you know that those instruments were properly cleaned and they're safe to touch and everything? You could go run a load, put it through. I take it out on the clean side. I don't look at the tape. I don't look at anything. Little did I know that you pushed basin for your cycle, and it's a whole load of instruments. So those instruments never got their instrument lubrication, and it was a short, quick cycle because basins are pretty, nothing, you know, no cracks or crevices in those instruments to get clean. So if you run that basin, did those instruments really get cleaned? So I highly recommend there again that you're looking at your printout tape. I see many times that you have the option to put a roll of tape in there, but most people don't. So put that tape in there, let it print out, result that load, just like you would a sterilizer. Have a document scanner, just like your sterilizer, scan that in, or even better, have it interfaced, and then that tape will automatically be uploaded electronic to that load. So some different options there. And, you know, decontam is, I always feel people either love or hate decontam, because yes, you're busy. Yes, it's, you know, nonstop. You're all in your PPE. So last thing you want to do is, you know, go take a break and put it all back on. But just keep in mind that it's your way of showing and documenting that your sets were cleaned. About 10 years ago, I was at a conference and the presenter was a malpractice attorney. And he said, I'm the person you love to hate because I'll get you every single time on documentation. He said, I've never been to court. I've never lost a case. All I do is go around and hospitals write me checks. So right there, I was like, oh, we don't like him. But we learned, he said, one example he gave was a patient went in for a total joint. I don't remember if he said knee or hip. Total joint, got an infection later on, bad infection that I think resulted in amputation. So then with that, they did some digging down. And he said, I asked for all the records. I asked for everything because I will get you on documentation. And he said, part of that was looking at the sets used on the patient. Looked at the total joint tray, got the records. And in the record in that history, it went from being used to assembly to sterilization. Sterilization parameters were all met. That was great. And he said, so you used it on the previous patient, didn't wash it, assembled it, and then sterilized it. No wonder why my patient got sick. The instruments were never cleaned. Well, we all know that those instruments were cleaned. And, without a doubt, because I'm not assembling bloody, icky instruments from a total joint case, but you didn't document it, it didn't happen. So here's where you really want to make sure that you're documenting. Get that decontaminant information there, show that it was cleaned. And as he said, he's a person we love to hate, because I feel like that was kind of stretching it. But yet, what do you do? If it wasn't documented, you're right, we didn't show that it was cleaned. There was nothing to show that. And you don't want to be at that hospital or have all the fingers then point at your department as to why they got infected. So next on here is container assembly. So if you're for our seasoned techs and leaders out there who remember when we had recipe cards. So years ago, yes, you would take this set to your workstation, you'd go to the recipe card, you'd pull out that recipe, and you'd know then what to put in there. Well, then came count sheets. We want a count sheet, we want to put it in the container so we can have it in the OR so we can see what goes in the set. Well, then everything went electronic. So you create it on a Word document or an Excel spreadsheet, print a bunch out, put them in a file cabinet. When you went to assemble it, you go grab a sheet of paper, check off the boxes. Now electronic. So how awesome is it how far we've come? And so with that, now when you're assembling in CensiTrac, you got two great options. One is I'm adding this to the stringer, I'm clicking the green button, adding everything, clicking the green button to show that I put it in there. But one of my favorite, or the favorite, and what I love is instrument marking. So with instrument marking, you're just scanning. So I'm scanning this, adding my sets to the container, and then I scan something and it pops up and says, this doesn't belong in here. Do you really want to add it? And I look at this and I'm like, well, what is this? And here I almost added the wrong instrument. So awesome way to make sure that your sets contain the correct instruments. People say to me, yes, but our count sheet says, B. Mueller, NL 1400, Edsel teeth, and this set has a Codman in there. Well, you go and build your substitutes. So if this is an accepted substitute and I scan it, it's going to accept it. It's going to go right along. It does take some time to build those substitutes. Census can obviously help you with that. But what a great way to know that you've got the exact things in your containers. Or if you have a surgeon that, they have to be the exact manufacturer item number for certain needle holders or graspers that he likes. Don't you dare put anything else in there. Great way to do it is you go and you have your instruments marked, scan them, and as I'm adding, and I try to add that Codman instead of that V. Mueller, I'm going to get a pop-up saying this doesn't belong. And I'm thinking, well, why not? This is a substitute. Nope, not for this tray. It's not. Maybe every other tray, but not this one. And so you've got that in there, probably with a pop-up too, saying you have to use exactly what's on the count sheet. But my favorite part of container assembly, which I love, previously missing. So when I look at my previously missing feature that we have now, so if I'm assembling this tray and I'm missing a medium Richardson retractor, first thing I'm going to do, I'm going to go look at my backup stock, see if there's one over there. And if there isn't, then I go look at all the baskets that came out with that wash load. Can't find it. Look at my peel pack area, see if there's one sitting over there. Nope. Peek my head through the pass-through window to decontam and say, hey, I'm missing a medium Richardson. Do you have one back there? Nope. Run up to the OR, look in the soil utility room, because maybe they found it when they turned over the room. Can't find it. Or maybe you call the OR to say, hey, I'm missing a medium Richardson. Do you know where it's at? So all this time is spent trying to find that instrument, which we have to do. I mean, we need to find it so we can have a complete set. But when you can't, then you just mark it as missing, print out that label, put it on the container, that wrap, and then it goes out to use. So when that set comes back again, it can be that same day, if it's a turnover. It could be next week, next month, next year, whenever it makes its way back through. I get that container, or someone else does. They scan it to container assembly module. Down in the right-hand corner, little box is going to show me what was previously missing. So now I see, oh, great. I know it was missing last time. All I have to do is go check the backup stock and see if it's been replenished. I don't have to waste, shouldn't say waste, but I don't have to go look at all those baskets, check the peel pack, decontam, or I don't have to do all that because it was missing last time. And so what a great way to save a lot of time in assembly. Everybody wants to be more efficient, but yet provide quality items. So there's a great way to do that. And then pictures. So when you're in container assembly, you can attach pictures. So years ago, when I was a scrub tech, we processed our own instruments. And with that, we had our stat C-section tray. So we had a big picture, like it was bigger than an 8x10 picture posted on the wall. And so if you were something that you had to make sure that set, and this is back when we had towels too, you just put it on the roll towel, and it had to go in exact order, facing exact direction, because what it was is that as a tech, I could go take that, put it on my draped mail stem, and then as I'm working with the surgeon, I'm just grabbing. It was just to get that baby out, because that when you get a stat C-section, it's boom, boom, boom. It was just to get that baby out. And so that tray had to be assembled perfect, and it was great to have that picture on the wall. Well, how great now that as I'm assembling in CensiTrac, I have that picture right on my screen. So I'm not having to walk back and forth and keep looking at the picture. We don't want anyone taking it down to get to their workstation because it would disappear. So great that we got those pictures. Along with that, you've got a surgeon that had a retractor modified. Keep in mind, you can attach that picture to that item. So if I'm peel packing it or putting it in a container, I'm going to have that picture and I'll know exactly, that yes, I have the right one and this is how it looks and everything. So just some education for staff. And then on to sterilization. So many times in our facilities, one of the things I'm seeing is a lot of, or I should say multiple error loads. Or I'm asked, we have so many error loads, what can I do to kind of decrease them? First thing I ask is, are your staff walking to the sterilizer and scanning a barcode on the sterilizer? Or do you have a sheet of paper that has, steam 1, steam 2, sterad 3, sterad 4, and they're scanning from a sheet of paper? And almost everybody says to me, no, we're scanning a sheet of paper. And I say, get rid of it. So if I scan a piece of paper and I'm thinking I'm going to put this in OR1, and I actually scan sterilizer 1, and then I scan sterilizer 2, I just now scan the wrong sterilizer. So with that, now if I catch it, I can just clear it before I click send scan data. Otherwise, I'm going to have an error load. If I have to physically walk over and scan sterilizer 1, because that's what I want to put it in, I get over there and I'm like, oh, there's a load going. I didn't realize that. Or there's a load cooling and I can't take it out yet. So now I'm going to go use OR2, or sorry, sterilizer 2. So I go scan sterilizer 2. I've got my correct one because I had to physically walk over and scan it. So I encourage everyone, get rid of those sheets of paper and walk over and scan them. I do see where you have your IUSS sterilizers for the OR. And maybe if you don't have a tablet or a PDA or some other portable device, or there's no computer up there, yes, then you probably do need a sterilizer barcode down in SPD or SPS for those. But I look at it as like that's a little different because chances are you're scanning all 3 of them for a Bowie Dick. You're walking up there, putting it in, bringing them down, resulting them. Then you're scanning them all for that biological, walking up there, putting them in. And so with that, you're kind of doing all 3 at once. If you're using it for IUSS and they're walking back and forth, they may be a little more tricky because you know which one is open, which you should. So you just want to make sure that you're staying on top of that one to avoid those error loads. So when creating a sterilizer load, I recommend, so you're going to scan a sterilizer barcode and then scan your items in order. So think of it as, left to right, top to bottom, like you're reading a book, or left to right, and then come back, and then, that way, kind of you have a 3-tiered. Because you want to be in order. So when you've scanned everything, and if you've scanned a biological, showing that you biological barcode, when you're done, you want to count everything. So make sure you count that biological pack too, if you scanned a barcode. So count all your items, look at your computer screen and look at and make sure that says total scanned equals the total that you have on your rack. If it doesn't, recount. Think of it as those two need to match. If they don't match, that tells me that I missed something. So count them again. If they still don't match, you have two options. Clear your screen and start over, or phone a friend. You get a coworker, they come over, here's where you want to make sure you stay in order. As you're going through and reading everything that's on that rack, or calling out the names, they're looking at the list and figuring out what you missed. I recommend doing peel packs first. 9 out of 10, if something was missed, it's a peel pack, which makes sense. A lot easier to miss a peel pack as you're scanning than it is, a big container or a wrap. So do your peel packs first. And I can almost guarantee you that's what's going to be that thing that was missed. So then as you're reading through and you say, add some with teeth, and they're like, nope. And you're like, oh, that must be what I missed. You scan it, it takes it, now your numbers match. You don't have to finish counting the rest of everything. And now you also know that everything then was documented, that it was sterilized. So if you're not counting and you miss something and you don't scan it, there's nothing in that container history showing that it was ever sterilized. And then on to documenting a process load. So when you create a load and or a BOIDIC load, the minute you click that BOIDIC button, it defaults in workflow load list in that load. It defaults that cycle to BOIDIC. However, it does not include the parameters. So when you go to resolve that, you do your pass fail, you have to go to that BOIDIC cycle, and from the drop down, select the one with the parameters. Now, if you look at your drop down and you've got a lot of different loads in there, I encourage you to go into administration, reprocessing machines, find that group. So if it's your steam sterilizers, it's your SteriAds, go into that group, click on the actions tab and cycles, and in there then clean up your cycles. So if you're seeing a bunch of error ones in there, or you have cycles that you don't use, I know that like liquid's an option in there, and that's kind of antiquated. You don't see liquid loads anymore really in a steam sterilizer. Uncheck the box. So uncheck the box for all those ones. You can even go to your sterilizers and either with your phone, take a picture or write down all the cycles that are even available on that sterilizer. Make sure those are the only loads or cycles that are available, because then staff aren't going to be, creating all these other cycles in there. And you can keep that list short and sweet. So rather than having to scroll through, 50 pre-back loads, now I've got 3. So there again, more efficient, nice time saver. And then on to indicators. So I do see sometimes people aren't using the load indicators module, and it's like, oh, we're just using paper. Well, here again, highly encourage everyone to use load indicators module. You got some nice safety features in there. So if I go and put in my control, and that's in there, it's in there, and I go now and I go to put in a biological that's processed, and I type in that lot number. If it doesn't match the control, it's not going to take it. It's going to stay red because it doesn't match. And so now I'm looking at it and I'm like, why is this not taking it? Well, maybe what happened, and I speak from experience, that we had some random BI that was, we had a drawer, pulled your packs out, put them in the sterilizer. We had one that no idea where it came from. We didn't know if did housekeeping find it, throw it on the counter, and someone threw it in the drawer, not looking to make sure it matched all the lot numbers. To this day, we never figured it out. But it didn't match. So if you're on paper, many times what I see is people are writing on a Post-it note that lot number for the day. Even if you're doing that for CensiTrac, get rid of that lot number. Make sure staff are looking at the biological in their hands, and they're looking and they're typing in that lot number in load indicators. It should turn green if it matches your control. And if it doesn't, then you got to drill down and figure out what's going on. Along with that, if you try to put a BI in an incorrect incubator, so if I'm trying to put a pre-back BI in a gravity incubator, CensiTrac's not going to take it. So it's not going to take it. You're going to get a pop-up saying, no, this is you can't put this in here. It's another safety feature in there. And then I've seen where if you put your control at the same time, the minute that controller reads that it says, you know, positive because the alarm's going off, they'll go right over and document in the book positive. But technically, you know, you should wait till the full 24 minutes or the full hour or 3 hours, depending on which one you have there. Along with that, then too, is I have seen where people will go and the minute, you know, that one says negative because, or positive because the alarm went off, then they'll just go and write the other one as pass, even though it hasn't finished. But they're like, well, no, because if it was going to fail, it would have failed. The alarm would have gone off by now. So not necessarily true. If people are quick to hit that, you know, alarm button, silence it. Helpful hint, if you use the 3M super rapid readout biologicals, if you look on there, there's a QR barcode. So if you are in the load indicators module and you're going to type in your lot number, take your handheld scanner and scan that QR barcode. If your scanner can read QR codes, it's going to populate that lot number for you. So that means you don't have to get your glasses and put them on, so you can read that little tiny faint number, or you don't have to worry about human error of transposing a number, especially if you're putting in the control. If you transpose that number, you know, it's going to take whatever number you put in. It's the later on when it doesn't match. So if you have that, take your scanner and try it, see if it works. You can save a few seconds there, and then know that you have accuracy. It does only work with those ones. The other manufacturers that have them out there that have a QR code, if you scan those, you're going to get like product number, manufacture date, expiration date, a bunch of other information. 3M, to my knowledge, is still the only one that has just the lot number. And then on to your continuous indicators. So VOIDIC, make sure you're scanning in that VOIDIC test. Make sure that that's in there. It's linked to your load, because then you have that electronic documentation for that. And then image. So if you have your sterilizers interface with CensiTrac, awesome. That's a great way to go, because that tape then that gives you all your parameters and temperatures and everything, that is electronically linked right to there. And it's all electronic. You don't worry about an image being clear. You know, can I read it? But if not, then you want to make sure you tear off that tape and scan it in. But let's go one step further. Once you've scanned it in, look at your image and make sure it's legible. Make sure you can see it. Because what I find, if you're like me, you don't like changing the ink or the tape, really, and the sterilizer. Never like changing the ink because it's, I don't know, it must have been me. It never worked for me, or I just would have issues with it. So I'd be like, oh yeah, this is fine. You know, I can still read it, which I could, but if I scanned it, can I read it? So that's where you encourage your staff to look at your image. Is it legible? Can you read it? Because if that print is too faint and you can't, you need to right away put in new ink and then reprint that tape so that way you have it. Also, you want to make sure that full image is on there. As you close a lid on like a document scanner, as that air escapes, many times it will move that tape, that VOIDIC test, or if you're scanning your chemical integrator into there, or even a wash test, it'll move, and now you've lost part of that image, or you've lost part of the information on the tape. So here's where you want to make sure that you're viewing that, especially your text, because it saves them a conversation with leadership if something's wrong. So make sure everything's in there, everything's beautiful, and they can read everything. So on to quality audits. So quality audits. One of the things is, you know, we encourage everyone to have full electronic documentation. If your facility still requires paper, you know, that's one thing. But if you're fully electronic and you need to find some information, the last thing you want to do is dig through a box of papers, especially if it's like from your endo area, because on the dirty side, those papers are dirty. Or if it's your wash test for your ultrasonic, those are in decontam, so those papers are dirty. You almost need a hazmat suit if you're going to dig through there. So let's go complete electronic documentation, and then if you have to keep your paper, then that's another thing. But yet, any information you need is going to be in your CensiTrac. So the way we want to make sure we're doing this, though, is do your quality audits. You want to look at every single load. You know, you can run a report, see if something is missing. That's great. But if you're going into the individual loads and you're looking, want to make sure that pass fail is in there. So that pass fail, always have to have it. And if someone created an error load, that's a fail. If with that, if they have their error loads, run a monthly report, quarterly, annual report of your failed. You may find that sterilizer 3 has failed, 3 times in the last month, but they ran it a second time and it worked. So no one told you about it. Well, maybe you have your sterilizer company come out and look at your sterilizer and say, why is this failing? Or you may find that it's error loads, it's all the same person. I had a gentleman that worked for me. Oh my gosh, sweetest man in the world. Last thing I ever want to do is go the corrective action route with him, but kept having issues with sterilizer loads, wash loads. And I knew he probably needed glasses. So kind of talking with him, have you had your eyes checked, just in casual conversation. And he's like, no. And I said, you know what, you probably should. Everybody should be in. And he went in, got glasses, and no longer had an issue. So you never know what's going on with people. But if you're running that report and you're seeing, that trend, that commonality of the same person, it's education. It's something you can help them with. Next year, look at that cycle. Make sure there's a cycle. So if it's a washer, it's your wash cycle, or it's your decontam descaler cycle. So different things that you maybe have in there. And if it's steam load, make sure you have parameters. You have to make sure you have parameters with all of your steam. And then indicators. So that would be your wash test, your BOIDIC, your biologicals, your chemical test strip, your chemical integrator. So anything that's in the indicators page, make sure it's complete. If you require staff to do the placement for your wash test, then I see sometimes it's blank, sometimes it's in there. Well, if some are doing it and some aren't, then really the ones that aren't, it's considered undocumented information. Make sure that lot number is in there for all your BOIDICs. And then onto image. So we talked about image, making sure it's legible. You then doing a quality audit want to make sure. And then I recommend you put QA in the notes section. So one thing with this is that when you're doing QA and you just click save, it's going to document who did that QA. So it'll say your name and the date and the time. Keep in mind, AAMI guidelines, so all this information we're putting in census or CensiTrac, AAMI guidelines always states name, date, and time. If you're on paper and you're documenting anything, many times I see, the date's the top of the page, and then you're just documenting down. Rarely do I see the time, and or I see initials. But or you're trying to read handwriting. But so even if you had wonderful, all your documentation was complete on paper, is it though if you don't have a name and you don't have a time? So here we go, electronic. Now it's 6 months out, and you need to find this set that was used on this patient, and then look at the history. Well, you can go dig through boxes of paper, or in about 30 seconds, you can have that report and that information right on a CensiTrac. So a lot easier to do it electronically. On to sterile storage. So with sterile storage, the good old LOL, it's CensiTrac, it's location, object location, not laugh out loud. But so when you're in there, scan your location, scan all your objects, scan your location. Think of it as when you scan your location, you're opening the cupboard door, then you scan all your objects, and you put them away. Scanning your location again is closing that cupboard door. Great way to keep everything going, scan everything to your locations. I see many times people aren't scanning to a location. So when I look, they have containers sitting there. When you look at the history, they're sitting in the sterilizer from 6 months ago, or a year ago, or last week, and we all know they're not there. So your CensiTrac is only going to be as good as you use it. And so then with that, if you are scanning to your location, then you know where to find something. So we had a situation where we were missing a container and couldn't find it, wasn't there on the shelf, went looked at the history, and here it was ortho, I remember that, and someone had scanned to ENT. So went to the ENT shelf, and there it was sitting there. So, Unfortunately, it was scanned in the wrong location, but fortunately they scanned it. So then we know where to find it. And then it was just education with that person to say, hey, careful when you're putting stuff away, you know, you scan this to ENT and it belongs in ortho. Make sure your storage locations are in, you know, connected to your containers and it prints on your label, because then anyone can put anything away. So if you have volunteers, if you have, you know, if you're OR, they have nothing to do, or they're, you know, cases get canceled. If you're fortunate enough that they come down to SPD and help you, then you could say, yeah, let's have you put stuff away. Because right there on the label, it's going to show where something belongs, and they can go right there and put it away. Good way for new staff too, to put them with putting things away, because then when they are putting things away, they're learning where things go. And then storage destination. Make sure you have, you know, don't just say clinic, derm clinic, peds clinic, surgery clinic, or your, you know, ICU, med surge. Create those locations, and then as you're returning stuff to there, scan it to there. So if they pick it up, so you have it in a bin or a shelf, if those bins swap out, put that barcode label right on the shelf where you're going to put it. So if they always know they come here and they get it, put that barcode there. And then as you put things in there, scan it. If you deliver your sets, I highly recommend you use a tablet, a PDA, or some other portable device. Bring it with you. Put those barcodes. So in the derm clinic, I'm going to have a barcode somewhere that says derm, and they're small. You know, you can put it in some hidden place or inside of a cupboard door or just somewhere on the shelf. So as I get there and I drop off these sets, I then go scan the location, scan my items, scan my location. I now then have it in real time, what time it was delivered, and then along with that, what was delivered. Because think about, and speak from experience again, let's just say the derm clinic calls you and they say, we're missing Mo's trays. You know, we sent you like 6 the other day and we haven't got any back. And I say, okay, you know, let me go look and see. I'll get right back to you. I go look at the container and I see that they were scanned to the ENT clinic. And I'm like, ooh. So I run up there. Sure enough, they're there. I bring them to them, like, oh, here you go. You know, don't tell them. I'm not going to air our dirty laundry. But so nice way to have that information. I knew right where to go get them and then brought them right to them. Now just some education with the person that delivered them. But if I'm not doing that, then it's like trying to find a needle in a haystack, because where in the world are those sets? They're not down here. First thing I would do, I'd look at my department. I would go up to derm clinic and look through everything myself, because they probably put them in the wrong area. But if they're not there, I mean, it's literally trying to find a needle in a haystack. And some of these facilities that I go into, they're huge, and this campus is huge. Or there's offsite clinics. So if you have offsite, I mean, I would be stopping at all of them on my way home from work, looking to see if they got delivered there. So scan. You know, maximize your use. It's there for you, and let's, you know, keep that going, so that way if you're looking for something, you need something, you know where it's at. Or they call you and say, you know, we haven't gotten our Mo's trays and we have procedures, and you say, oh, looks like they were delivered to you about 10 minutes ago. And now the clinic's like, oh, okay, yeah, I looked about 30 minutes ago and then got busy and forgot to call, and I just called you. So how nice that you're able to then look and say, oh, they were delivered. And then next on here is case card assembly. So case card assembly, super easy module to use. You know, here again, that decontam module, when you get your case cards in decontam, make sure you're scanning them. If you scan to the decontam module, I think I preach decontam module all the time, it's going to empty that case card. So all those items are on there, all those fuel packs are on there, they're all just going to come off. If I look at the history, you know, on that container, it'll show that the last scan was, you know, case cart maybe, but it's going to come out of that case cart. It's not going to automatically put those items into decontam. Those you still have to scan separately. So I would basically scan my case cart and scan everything inside of it when I'm in decontam. And many people say, you know, why? That's just so much work. Well, because you don't know what's in that case cart. So this case cart could have been built, and then it goes to the OR. during that procedure, you don't know if they added something. So if they had a bleeder, or there was an issue, they contaminated during the procedure, had to go grab another container and open it. You don't know what was added. You also don't know if something wasn't used. It could be sitting on a return cart and it hasn't been scanned back to the shelf yet. If it was scanned back to the shelf, yes, it'll come out of the case cart. But if it hasn't been scanned yet, by the time you scan and decontam, you don't want it scanned and decontam because it's going back on the shelf. So you've got to scan those individual items that are in there. And then when building a case cart, here, a lot of people ask me, we stopped using it because it doesn't ever work for us. And I'm like, well, why doesn't it work? And I said, what was your process? We'd scan the case cart, we'd scan everything, and we'd scan the case cart. And I said, it's not LOL. LOL does not apply to case cart assembly because a case cart is not a location. It's a mobile asset. So you have to scan case cart, all your items, and then click close. Now you can use kind of that LOL thought process a little bit. So if I scan case cart 12 and I scan all my items, and then I go to scan my next case cart 8, then I can do that. So when you're done with this case cart, you have to either click the close button or you have to scan a different case cart, not the same one. So kind of a helpful hint there. People didn't know that you could scan the next case cart or wondering why it doesn't work for them. If you're doing LOL, it's not going to work. And then when you're done and you've got everything in there and you're good to go, then scan that case cart to its pre-op location. Think of it as closing the loop and locking things down because SPD is done with it. It's now to the OR. There again, I'm looking for something. I can see it's on case cart 12, and case cart 12 is in OR holding, or case cart 12 is OR 5. So now we know where to find something if we need it. So use that, maximize that use. Case carts are super easy to use. With your label placement, make sure those labels are easy to read. So many times I see like a case cart that opens with 2 doors, or even just 1 door, I'll see the labels there on the door. Okay, but once I open the door, my label's gone. And many times they come to you with the doors open because they've gone through the cart washer. So put that label where it can easily be scanned. I always put them on the right-hand side because most people are right-handed. And then that's where you're gonna be holding that scanner. So come from the right and scan, and then be consistent with your placement. I'm not looking all over trying to find it. I always say have one, when I'm facing to build, have one here very visible. And then when they're up in the OR, if they're like an OR holding area and they're kind of stacked with like the short side out, label both sides of that cart. Put one on either side. Because now if I'm looking for case cart 12, the last thing I want to have to do is pull all my carts out and look at them and see what number it is. And then I also will put one on the inside. So kind of hidden away where it's not going to get the wear and tear of bumping into walls, going through the cart washer. So when those labels start to chip and peel and crack, then, or they get gouges in them because they've hit a wall or they've hit something, then I've got that one inside there that's protected. So I always know which case cart number this is. And then 2, when you see that here's a helpful hint for you. When you see that they're chipped, or cracked or peeling, you need to replace them. You got a cart washer, get it right when it comes out because the cart is hot. And I usually take my fingernail, but if you have a little scraper or something, that label will probably peel right off. So when I'm on site doing training and I'm looking at case carts, I am right there at that cart washer getting those case carts right when they come out, because then that label peels off versus having to scrape or get a razor blade or who knows what. So look at those labels, make sure they're good, make sure everything is, it can be scanned, and then go from there. All right, so out of sequence. This is part of your life cycle of a container. One of our features, just want to put this one in here. A lot of people don't know about it. So think of that sequence: decontam, assembly, sterilization, storage, point of use, decontam. If decontam, assembly, sterilization, one of those steps are missed, you're gonna get a pop-up if your out of sequence is turned on. And that's telling me, whoa, stop, wait a minute. So if I gotta put something away and I get a pop-up saying, stop, this item hasn't been sterilized. I look at it and I'm like, oh my goodness, I must put this away, and here the tape can change. I'm like, I thought this was all sterilized stuff. right there, I stopped some unintended consequences if those unsterile items were left my department or made its way to a patient. Or maybe I look at this, I'm like, well, I know it was. I took it out of the sterilizer. I know it was sterilized. No, what that tells me is whoever created that load, they didn't scan it to the sterilizer, so they didn't count to make sure they match. And so there's no documentation showing it was sterilized. And if you didn't document it, it didn't happen. So then that needs to go back, go through the process and be sterilized. I could go and I'm in assembly. I take something out of the washer and I go to assemble it and it says stop, item hasn't been cleaned. So don't just turn this on. You need to have a process. You need to have a policy or SOP in place for this, because as you are implementing and using your audit sequence, what are staff to do? So I always ask yourself that when you're doing this. If I'm in assembly and I get something, I took it out of the washer, can I just hold up the pass-through window and that staff member can just scan it through the window? So now it's documented went through decontam? Great, but you know what? It's not real time. So is that okay at your facility, or do they need to send it all the way back through? The other thing with that is if you say no, send it back through. Nope, that's how they're gonna learn. This is the way it needs to be done. Okay, but what if it's a turnover item? What if we don't have time to send it all the way back through and come to the wash again? So there's a lot of these different variables you got to consider. And everything might be a case-by-case basis. But the good thing about this is that you can run a report. So run a daily report. You can hide times, you can hide the users, that don't have that print if you don't want, and then post that in your department, bring it to morning huddle, afternoon huddle, whatever, where you have communication with staff, because that's how they're going to learn. And they're going to realize, oh, I guess I shouldn't ignore that. I just ignored it because I took it out of the washer, so I knew it was clean. So I just knew there was some mistake in CensiTrac. Well, no, there's not a mistake in CensiTrac. What that's saying is that no one scanned it in decontam. If there's no documentation in that container history, it never happened. So great way to, as I said, I think the most important thing is to help prevent an unsterile item from making its way out of your department. We know it happens. We know we've seen it. Here in my town, we had it where it was 2 total joint cases made their way to an OR. So kind of a domino effect there, but it was on the news, as everybody talked about, wasn't my hospital. And they didn't have CensiTrac. So if they had CensiTrac, they'd had this turned on, that never would have happened. So there again, consider this, turn it on, and keep everybody safe. So facts, we're making a difference. So when you look at the number of infections, they're decreasing. So we're on that right path. Nobody wants to turn back. We all know sterile processing is a very detail-oriented job. It's a lot of work and it's rewarding. But I want you guys to know that you play an integral part of every surgery and procedure. Think of it, you're saving a life just as much as that doctor, that surgeon, that radiologist, that nurse, because you're preparing the instruments so they can do their job. You're sterilizing them so that they're good to use, they're safe to use. And with that, just remember, document, document, document. If you didn't document it, it didn't happen. And, we want to keep everybody safe. We want to keep ourselves safe. And, everybody says, what if that was you on the table or your family member or your loved one? You never know. I know someone that she actually had a heart attack, ended up in the hospital that she worked at, and she was sterile processing. She was telling me this and I was laughing. And I'm like, I don't know if I should be laughing because what happened, or I don't know if I should be laughing the way you're telling it to me. But her boss came to visit her and she said, can I go down and process my instruments for my bypass surgery tomorrow? And her boss was like, what? No, like you're not going anywhere, but I'm more concerned as to why you want to do your own instruments. And she's like, because I don't trust people. And she said, okay, first of all, I'm going to go down and personally make sure your instruments are perfect. These are yours. Is there someone you trust? She's like, yes. So she had one person do them. She's like, but when you recover and you're back at work, we're going to have a talk. They turned that whole department upside down because it was somebody that finally was like, we're not doing things as we should. Don't want that kind of an eye opener. Hopefully we can be a little proactive and not have things like that happen. So just remember, our goal is to provide quality products. You never know when it's you or your family member, and just document everything you're supposed to have. So thank you for participating in today's life cycle of a container presentation. Please join us this afternoon. We're going to dig deeper into our container module and learn about all the wonderful capabilities, options, functions that are available to you. And then you're going to have some hands-on. You're going to be doing these things. You're going to learn about these things. Then run some reports. So you can identify what containers are a priority, you know, because you think, well, should they be a priority? You can look and see when was something the last scan. I see this set, oh my gosh, it hasn't been scanned in 2 years. And I realize it's sitting on the shelf collecting dust, or maybe it's in a clinic or in an OR just collecting dust because nobody uses it anymore. Well, can we break it down and, you know, repurpose those instruments? So some great report things in there with containers. And so we'll go next with questions and answers. I know we only have a few minutes. Maybe we can get 1 or 2 questions in, but then make sure you join us this afternoon. Here on the screen, I will leave this up. If you have any questions, always feel free to reach out to our help desk or your client manager. They can always, you know, help you, assist you with something, or connect you with the correct person if you have a question. So, Grace,
hey, Kelly,
that's going to do questions.
Hey, Kelly, before we jump into questions, I just want to call out in the chat, the CE certificate link is there. And the key word for that certificate is containers. So with that, I think Linda's going to help facilitate the Q&A with you.
Wonderful. Thank you.
Yes, Kelly. So we have a couple questions here, and I'm going to put 2 together. One is, can a quality feedback label be made for any event besides pre-cleaning, such as for sharps? And the second part of that is, can you provide any suggestions on how to get the OR involved in using the quality feedback module?
Yep. So yes. Oh my gosh, sharps. Create that quality feedback label that just says, you know, sharps and decontam. I'd even put one for sharps and assembly. As we've seen those come through washer. If you're doing the barcode especially, it's not really going to be bogged down because you're going to separate. This one applies to decontam, print that out. This one applies to assembly, print that out, OR, etc. And so then if I'm in decontam and I have a sharps in a container or a tray, I scan that sharps, I scan that tray, I scan that sharps. Now I can speak from experience that when you are doing this, run reports, look for trends. We were talking like, why is it? It's like this time of year, we just got bombarded with sharps. What is going on? It's always the ER. I couldn't figure it out. And one of my staff members said, it's because that's when they get new med students and residents. And I was like, oh my gosh, you're right. Worked with the director of that program and said, we need education. We need to work with them, blah, blah, blah. We saw a huge decrease. Along with that, I said, you also need to buy Pakistan needle holders and AdSense with teeth, because when you get new residents, they steal them all because they want to go home and practice suturing. So I gave her the information to order Pakistan, and we no longer had our good needle holders and AdSense disappear. With your OR, show them the barcode sheet. You know, if they've got a barcode and they got CensiTrac, they can, you know, if you think like, oh, I have to write out this whole piece of paper, or I have to go into CensiTrac and fill all this information, a lot of people are less likely to use it. One hospital I was a manager at, they said, oh, it's always so-and-so and so-and-so. And literally was 2 people that would only do our quality event forms. And they're like, you know, they just don't like us. No one else does it. I don't know, they pick on us. And I said, no, we're fortunate that they're doing it, but they're the only ones. You know, we want to make sure that they're doing it. I also had where we were on paper and found out my night shift person was going up and taking them out of my mailbox if they were her or one of her friends. So if it's electronic and it's in there, nobody can go in and take it out, a piece of paper out of there. So yes, get your OR to use it, especially if it's a barcode they can scan. You know, figure out what are the issues: missing chemical integrator, incorrect instrument, soiled or debris in pan. You know, make it kind of specific and then limited though, so that way then it's easier for you to identify those trends and patterns as to what's going on. And then maybe we're over a little bit. Can we do one more question?
Yes, the OR is currently scanning the cart and the instruments to decontam so they can show accountability for pre-cleaning. Would it be better to switch to a location barcode to track pre-cleaning in the room?
So yes, what I would recommend is that you create a location label, a barcode label, that says, it's all free text, so whatever you want on there, but it could be a decontam, or, sent to decontam. So that way they're just scanning everything right to decontam. Or if you could say, pre-cleaned and sent to decontam. So that's all just one. And now they're scanning it and then they send it on down. So one thing is, if they're doing it in their room or they're doing it when they get to decontam, I've seen it in decontam where there's a handheld right there, or there's a workstation on wheels or computer. They log in quick and then they scan right there. So whatever works for your hospital, whatever works best for everybody. But the nice thing about that is, if you have a time when things arrive in decontam, and then now you're looking to say, here's what was scanned in the decontam module, and then assembly and sterilization, etc. You're going to come up with some real times as to how long does it really take to process a set. Many times we hear 3 hours. Okay, well, that's if all the stars have lined up. Yes, that means you dropped it off. I took it right to the sink. I put it right to the washer. I took it right to assembly. I put it right in the sterilizer rack. That sterilizer load went in right then and there. We know that doesn't always happen. You wait until you get a full load for the washer. You wait to get a full load for the sterilizer. So you can run some reports, and with that, you can identify some bottlenecks. So I had one hospital, their bottleneck was their ultrasonic. They had one, and everything had to go through the ultrasonic. They obviously knew they needed a lot more ultrasonics. So, yes, it's one thing to say we know this, but then they had that data. So when they went for a capital request to say we need more ultrasonics, they had it right there in their CensiTrac reporting, along with like the SBAR that they created saying, here's why we need it. So I think that is it for this session. Thank you again, everyone. Any questions? There again, call our help desk. More than happy to assist anyone. And then if there's questions that we didn't get to, what we can do is we'll kind of put together those questions, answer them, send them out to our participants. And again, that keyword is containers. So with S plural on the end. And so make sure you get your CE credits for this, and we will see you this afternoon and again tomorrow. So we have more sessions tomorrow. If you haven't registered, go do that quick. And thank you. Have a great day, and stay safe out there in this crazy world.